My name is Tom Adams, and I'm a student counsellor at the Student Counselling Service at Trinity College in Dublin. And the Student Counselling Service will be leading the mental health component of the OEduverse winter workshop, which is going to be taking place in January. So I'd like to just briefly talk to you about what that workshop is going to entail, at least in terms of the mental health aspect. So as you can see, the title is Looking After Your Mental Health in Research Careers. And I'd like to start just by looking at the concept of mental health briefly. So the definition that you can see in front of you, it's actually comprised of two, one original one by Sigmund Freud and a recent one by the World Health Organization. But as you can see, it frames mental health or mental well-being as numerous things. So one is the ability to work. So that sense of agency that comes from being engaged in meaningful activity, the ability to love and be engaged in authentic relationships with other people, the ability to play, which might seem a bit trivial, but it's really important to be able to infuse life with that sense of enjoyment and to get involved in things rather than simply observing. And finally, the ability to be resilient, and so to tolerate a certain amount of stress and distress. And I think this one is particularly important because it speaks to mental health as not just the absence of stress and distress, but the capacity to tolerate a certain amount of these things. And I guess that's as we're going to look at, very pertinent to early career researchers and PhD students who have to contend with quite a lot of it. So in that context, what are some of the mental health myths that we see at the counselling service when we're engaging with early career researchers or PhD students? So that sense of, I'm struggling and this must be my fault, or I feel like an imposter, I don't belong here because I seem to be the only person finding things difficult. And so there must be something wrong with me for feeling this way. These feelings are really intolerable. I have to get rid of them. And by getting rid of them, well, that will allow me to concentrate on my research. And I mean, we've deemed them myths here, but another way of framing that might be misconceptions. And I have to say that they're completely understandable. We all do this at times, have that sense of if we're struggling, then we must be the only people feeling this. And again, this is something we see a lot when it comes to early career researchers, but on account of seeing this so often, that really speaks to the pervasiveness and universality of some of these experiences. And I suppose in terms of the last two there, that desire to get rid of painful feelings, well, again, that's very understandable. Unfortunately, we often find that feelings have a tendency of rearing their heads even when we don't want to experience them. And in the long run, it might be better or more useful if we have some kind of strategies to manage them rather than trying to suppress them. So I just want to acknowledge some of those stresses in a researcher's life, and I'm sure many of the people here today can relate to this, but that sense of never feeling like you've done quite enough and having to balance research, your research project with life demands and the imbalances that can arise there, worries about career and finances, what to do after the PhD or after this piece of research, that sense of isolation from family and friends who perhaps can't understand what you're doing, or maybe some physical distance there as you've moved to a new culture or environment and you have to adapt to that. It's very challenging. Then working in between distant deadlines and having to calibrate yourself when there are those distant deadlines and trying to maintain that focus and motivation. And finally, and perhaps in a sense, one of the most pertinent things, navigating that relationship with the supervisor that is just, or can just be inherently challenging. And I think the combination of these stresses describes the fact that the researcher's path is inherently challenging too. And if these stresses accumulate, then it's inevitable that that can impact on your mental health, which of course can impact then on your research project. And then you can find yourself in this self-perpetuating cycle where things begin to snowball. And that can be quite a worrying and scary place. So once again, I really want to emphasize the importance of having a strategy and skills to manage mental health in that context. So in terms of the OEduverse Winter School and what we will be focusing on in this context, so identifying emotional needs. So what do I need and how can I meet that need? Engaging with the inner critic that is often quite prominent when we're struggling, how to invest in self-care, and how to manage some of these really powerful emotions that we might experience at times. So those speak to the self-care component. Next then, some communication strategies with the supervisor, some verbal and non-communication skills that you can use in all contexts, how to establish boundaries and structure when navigating these relationships, and how to provide and receive constructive feedback. Finally then, and these three here on the right, the first three at least, speak to the different systems and groups that you might be part of. So understanding some of those contexts and looking at how to foster community within them and how to identify supports and resources to mitigate that experience of isolation that can occur at times. So they're all of the things that we will be focused on, and they will be drawn together to allow participants to put together a mental well-being roadmap that they can hopefully then implement as they continue with their research project. So in terms of the intended outcomes of this workshop in the winter school, so firstly, to support researchers to identify mental health challenges. So once they know where they are and what the challenges are and feel more orientated, then there's scope to build some effective coping strategies. And finally then to facilitate researchers to establish some more supportive communities. And I think that both pertains to the networks and communities and you have in your own contexts in terms of your institution or your country, your immediate community, your family. But also one thing we found, or the team found the last time the summer school was run under the OEduverse banner, was that the participants actually formed their own mutually supportive communities, which were then transplanted to their own kind of research project afterwards and provided a very valuable source of support as they pursued their research projects. So that's what we'd like to bring to you, and thank you very much for listening to me, and I really hope to see some of you at the winter school in January.